I see patients struggling with penile injections. I see patients delaying penile implants as much as possible. I see patients overdosing on oral therapies and having to suffer with some of the side effects, such as headache, nausea, heartburn, back pain. We have patients that take daily tadalafil, Cialis, and then they overdose with Viagra and then do a penile injections. And some patients use a vacuum device with oral therapy. All these procedures are so complicated and cumbersome when you compare it to a penile implant. We prepare the skin 2 or 3 days in advance before the procedure with surgical soap such as Hibiclens. We perform the procedure with spinal anesthesia, which is a wonderful anesthesia for this type of procedure. It will dilate the penis for the surgeon and also will prevent postoperative pain in the recovery room. Patients with spinal anesthesia never get deep vein thrombosis, which is blood clotting in the legs, so it's a very, very safe type of anesthesia. The patient will be numb from the waist down for about 2 to 3 hours. The procedure itself takes about 45 minutes to an hour. There is no blood loss, so we don't even type a person's blood. We insist on getting a cardiac clearance of all the patients for several reasons. Patients who have erectile dysfunction, especially if a patient has diabetes, can also have underlying cardiac disease. We want to make sure that it's safe for the patient to have the procedure. Safety is our #1 concern. By utilizing a minimally invasive midline scroll incision, we never ever keep patients overnight in the hospital. We have not kept the patients for over 20 years. Patients are discharged usually 2 to 3 hours after the procedure. As soon as they can move their legs, they go back home or to their hotel. We ask patients to stay in bed as much as possible for 2 days after the procedure with ice in order to minimize swelling. And patients then begin to inflate and deflate the device on the 3rd day after the surgery. In general, patients that are over 40 years old, we do send to a cardiologist and obtain a cardiac clearance. Patient can also obtain a medical clearance from their family doctor, from their internist. What's important here is patient safety. Also, the anesthesiologist will meet the patient approximately maybe 5-10 minutes before the procedure. So it's good to have a narrative of the patient's overall health for the anesthesiologist to have there. For patients that have any history of cardiac disease, all the patients that have diabetes, patients that have had previous surgery, all of these patients, we obtain a cardiac clearance, and that clearance actually gets reviewed by the anesthesiologist before the patient is actually scheduled for the surgery. Every patient that is discharged on the same day as the procedure on an ambulatory basis will need to have an escort to be transported to their home. Usually it's either a partner, a wife, or a brother, or a friend. For patients who travel to have the implant, we have a dedicated escort system. It is actually called a discreet chaperone. It is at the patient's cost, but is arranged in advance. The escort will bring you, take you from the recovery room, bring you back to the hotel, or take you back to your home. All patients have a pre-operative visit. During that visit, the patient is given very clear written instructions on what is supposed to be done before the implant. For example, patients need to wash for 3 days with Hibiclens twice a day. One needs to avoid shaving the scrotal skin. Shaving in advance increases the infection rate. We also want patients to take an antibiotics the night before. We want patients to optimize their sugar levels in the blood. For patients who have diabetes, any patient that will have uncontrolled diabetes will be rescheduled. We also give patients all the prescriptions for after the surgery so they don't have to worry about getting those prescriptions, including pain medication. We like patients to use ibuprofen, Motrin as much as possible, and avoid the narcotics. Patients usually only need the narcotics the first 2 or 3 nights after the procedure. We also make sure that the patient urinates well. A lot of patients who have erectile dysfunction also have an enlarged prostate or difficulty with urination. Patients may not be able to empty their bladder fully. So by noticing this in advance, we can prevent difficulty with urination after the procedure. Patients who've had prostate cancer surgery, about 20% of those patients have a stricture or narrowing of the urethra near the bladder, and those patients need to be evaluated with a cystoscopy in order to prevent a nasty surprise of not being able to put the catheter during the surgery. Now, in addition, we also give patients instructions on how to inflate, deflate their implant. Patients are provided with a model of the pump so that they can orient themselves while they're starting to inflate, deflate. Patients are provided a warranty of the device as well as a letter that describes that the device is MRI compatible. Those are very useful things to have should a person require an MRI study in the future. In general, we like patients to continue their medications. Blood thinners such as Plavix needs to be stopped at least for 7 days. Patients who have a history of coronary disease need to take their baby aspirin continuously, even the day of their procedure. Patients should stop eating and drinking at midnight the day before their surgery. Patients will need to take their medication with a little sip of water. You should not drink any solids such as coffee with milk or anything like that the morning of the surgery. If a patient has the surgery very late in the day, sometimes we allow patients to drink clear liquids such as Gatorade or water until 6 hours before the anticipated procedure. In general, however, please avoid any eating or drinking at midnight the day prior to the procedure. Pack lightly when you come in on the day of the procedure. Wear loose-fitting pants. Avoid any valuables. You probably will need to bring in your ID and your insurance card. You will also need to bring your glasses so that you may need to sign consents and read the consent. But otherwise, there's no need to bring anything. We do provide with an athletic supporter at the end of the procedure for patients to go home with. Patients should not shave their pubic hair before the surgery. Any nicks that occur while shaving will act as a growth medium for bacteria and increase the colony count of the skin and increase the risk of infection. We shave the patient immediately before prepping the skin before the surgery. When you come into the surgical ambulatory surgery center, you will be greeted by a nurse. The nurse will place an IV. You'll receive IV antibiotics, and then after being interviewed by the anesthesiologist, and after I see and talk to the patient will be brought to the operating room. If you have any questions or concerns before the penile implant procedure, please don't hesitate to call my office and speak to either Janice, Ruby, or Sylvia. My staff has been with me for over 20 years. They know the answer to any question that you may have. You also have my cell phone number, so please feel free to call. It's best to call than to worry. If I don't answer, please leave me a message. I may be in the operating room and we'll call you back in between surgeries. Sylvia is extremely knowledgeable on penile implants. She also teaches patients how to inflate, deflate for those who have difficulty, and she can answer every question regarding the procedure.